Hi, I'm Marvin Roy Lapasa, third-year medical student from the University of Cebu School of Medicine. Today I will be demonstrating the proper gowning and gloving procedure. So let us begin. So suppose we just finished scrubbing our hands, so we will need to dry it using a sterile towel. So as we pick the sterile towel from the sterile table, make sure not to drip water in the sterile table when picking up the sterile towel. Slightly bend and pick our towel. Then let it fall down. So in drying our hands, we do the same pattern as what we did in the scrubbing, which is to start first in the hand going down to the wrist, to the forearm, and your elbow. So like this. Finishing off in the elbow. And using the other end of the towel, we'll use this for the other hand. Going down to the wrist, then to the forearm, then finishing off in the elbow. And make sure to dispose the towel properly in the appropriate containers. So now we are ready for donning of the gown. For the purposes of this demonstration, I will only be using a lab gown. So make sure not to contaminate the sterile area, so we just need to back off a little. So if you're picking up the gown using your right hand, then you have to make sure to get the right side. Whereas if you're using the left hand, make sure to get the left side of the gown. So let's do it in the right side. Pick the gown, let it fall down, just like the towel. Then insert your hand, then look for the left arm, then insert your left arm. Slide forward. Make sure not to slide your hands all the way out of the gown. Now the sterile gowns we usually use in the OR usually has a tie. So for the purposes of this demonstration, I will have this one as my tie. So usually there's a tag in here. There's a paper tag in here that I will give to the circulator. And as I turn, the circulator will close off the back of my gown. And that's how we don our surgical gowns. Now we will proceed to gloving. So we'll now proceed with gloving using the close gloving techniques. So we'll now open our gloves. We'll now glove our right hand first. So we'll pick the right glove using our left hand and put it over the right hand. Now I will hold the outer cuff using my left hand and the inner cuff using my right hand. Then I will slowly flip it over my right hand and slip it in like that. And do some adjustments in the gown. Then same thing for the left glove. Pick it with your right hand. Put it over your left hand. Then hold the outer cuff with your right hand and the inner cuff with your left hand. Then flip it over. Then slide your hand all the way in. And adjust your gown. So that's how we do our gloving using the close gloving technique. Now lastly, we will wear a sterile mask. This is usually done with assistance. Now when you're all done, just keep your hands together like this, and you are now ready to begin the operation.